We've spent a lot of time talking about this, the potential impact on about 25 million Americans. However, you have a very contrarian take. You say it's going to impact a much lower number of Americans. Can you just explain your thesis and why you think it's going to be just a fraction of that 25 million genuinely affected?
Yeah, look, at the end of the day, we've been talking about this for the first note we published was 772 days ago. So long time conversation. When you look at the 25 million Americans, what you see is more than half of which are under 200% of the federal poverty level, which means they are highly subsidized and they do not, the premiums could rise 100%. And if you're fully subsidized, who cares? Because it's not coming out of your pocket. And so when we actually peel back the numbers of the people that are going to be impacted, what we see is the majority of those on the exchanges are likely to see little impact because they can either down select to a slightly worse, lower quality plan and pay the same as they're paying now, or continue to be fully subsidized.
All right. So, Chris, I do have to say, I mean, you're already starting off saying they're going to downgrade to a lesser plan and pay the same amount. So they're getting less. I think even you admit that. You're saying it's a slightly less, but they're going to get less. And then at the same time, there's going to be an impact not only to healthcare companies, to employers, but to the people who are getting the service themselves. I want to start off with the companies first. Even you admit a number of healthcare companies are going to be impacted. We have estimates that it's going to be about a $32 billion loss of revenue if these subsidies go away. So let's go through the companies that you say are impacted. One of them is Oscar, other companies in line with that. So that's a big impact to the healthcare sector, right?
It will be a big impact to companies that are making money off of the exchanges, 100%. You've seen dramatic growth. At the end of the Trump administration, it was 11 million people. Now it's 25 million people on the exchanges. There's multiple evidence, including a recent government watchdog report of fraud in the programs. And so what you're seeing is probably 5 million, 6 million people that don't even know they have these plans at this point, but the companies are getting premiums for those. And so a lot of what we're seeing Congress propose is trying to crack down on that fraud. So whether they do the extensions go away or they do changes, extend it with crackdowns on fraud, you are going to see fewer people on the exchanges, which is a negative impact for the insurers. Depending on how many real people that actually use healthcare are losing their coverage will determine the impact on names like HCA and Tenet Healthcare hospital systems.
All right. I want to go to the other side of the coin, small businesses. So small businesses have been some of the fastest enrollees of the Affordable Care Act. And if their premiums go up, or at least the cost to help their employees get health insurance, doesn't that also impact hiring? Doesn't that also impact their ability to give raises? Doesn't it have broader economic impact?
It does have broader economic impact. It's also worth keeping in mind that we're talking about 25 million people out of a nation of 340 million right now.
But everybody doesn't work.
That isn't to lessen it for the people.
25 million is a bigger percentage of the people that actually work. We have 330 million, but not everybody actually works.
Sure. They don't all work, no question about that. But what I will say is that when looking at this, will there be an impact on some small businesses that choose to help fund through ICRA individuals on the exchanges? No question. But that number is probably less than 5 million, probably less than 3, to be honest. And so there will be a pass-through of this, no question. If people are paying more for their health premiums, they have less money to spend on other things. There's no question about that. The debate really is, should they continue the subsidies at the current level or should they not? And that is tax dollars that they have to decide what to do.
All right. Chris, I also want to get your forecast. We're going to look at the Kalshi odds very quickly of these subsidies being passed. If you look here on the prediction markets, 50% chance of it happening before 2027, only a 6% chance of it happening before 2026. And that's really the time frame that we're talking about right now. What's your forecast?
I think it's less than 1 in 3 we see them done at all. At any time at this point. So I think the odds by year end are way below that. If this isn't done by the end of January, it's not getting done.